FIFO boss leads Victoria's flagship youth mental health service amid reports of patient deaths and violence. In a concerning development, Victoria's groundbreaking youth mental health service, the Parkville Youth Mental Health and Wellbeing Service, is facing significant challenges under the leadership of a fly-in, fly-out CEO, Dr. Leanne Geppert. This service, which opened in June 2025, was envisioned as a major response to the Mental Health Royal Commission, aiming to provide dedicated public mental health services for young people aged 12 to 25. However, recent reports paint a grim picture of deteriorating patient care, staff exodus, and a host of other issues. One of the most alarming aspects is the absence of the CEO, Dr. Geppert, who resides in Queensland and only occasionally visits the service. This has led to a sense of absentee management, with staff expressing frustration over the lack of senior leadership and support. At least 6 senior youth mental health clinicians have quit, and 2 patient deaths have been referred to the coroner, indicating a deeper crisis within the service. The service's reputation has also been tarnished by incidents of violence and drug use. 4 machete-wielding thugs recently assaulted 2 people at the Sunshine campus, and there are widespread concerns about the use of drugs in secure wards, with staff claiming that the management is more focused on maintaining its brand image than on patient care. The situation has sparked concern among experts, including Professor Pat McGorry, who presented a 6-page briefing to the Mental Health Minister, Ingrid Stitt. McGorry's briefing highlights the service's failure to deliver safe, high-quality, and sustainable care, with a lack of staff and a decline in adherence to clinical practice guidelines. He warns that the absentee model of management may have contributed to a wider crisis, undermining the post-Royal Commission reforms. The service's workforce has grown by 42% in its first year, but this has not addressed the challenges of recruitment and retention. Staff, including a nurse who spoke of a recent patient death, expressed distress and a sense of harm caused by the service's shortcomings. The Health and Community Services Union's Victorian Branch Secretary, Paul Healy, calls for urgent government intervention to address staffing shortages and funding. The exodus of experienced clinicians and the service's shift towards a corporate structure have raised concerns about the quality of care. A senior psychiatrist working at the service criticizes the management's focus on corporate targets and the abandonment of the internationally recognized model that has achieved positive patient outcomes. This shift has led to a decline in care for complex patients, with a preference for low-acuity patients that look better on reporting spreadsheets. As the service grapples with these issues, WorkSafe has confirmed that it is monitoring the service over ongoing incidents, and the Australian Medical Association's Victorian President, Dr. Simon Judkins, warns that the service's once world-renowned reputation may be at stake if it is not immediately turned around. The situation underscores the urgent need for effective leadership and a renewed focus on patient care in this critical mental health service.